Hey guys, welcome to my channel. My name is Chantelli, and I just would like to thank you for clicking on this video. And today I'm talking about substance abuse treatment options. First, I want to start the video out by saying that I'm not a professional at all. I'm just a person who is an addict in recovery, and I just want to explain, what treatment options have worked for me. So I guess I'm going to go back and I'm going to start with the first time I got sober, and that was in 2008, I believe. I got in trouble, and technically this isn't really like a treatment option, but it was kind of what happened to me. I got in trouble for a second offense DUI, and I did 4.5 months in jail, so I was forced to be away from everything, which was very helpful. I mean, actually, it helped me out a lot, even though there was really no treatment in there, but all you have time to do in there is think about stuff, and, I knew that I was definitely, you think back on all the things you did as you were using, and, it makes you feel ashamed, obviously, so, even though it wasn't technically a long-term inpatient treatment situation, it was still like a long-term situation where I was away from all the drug dealers, all my so-called friends, that were partying and all that at the time. And it got me out of the strip club where I used to work. I actually worked in the strip club for many years in my 20s, and even part of my 30s I did. But anyhow, I was drinking a lot, obviously, which is how I ended up getting the DUI, and when I got out, I actually was sober for 3 years straight. Didn't do anything, no drugs, nothing. Went to college, and then, unfortunately, I met a toxic person and got into a relationship, and that definitely wreaked havoc on my life, and I've put that story time up on my YouTube channel. I've done a video about that already, so if you want to, you can go watch that one. But anyhow, so what really happened at first was that in 2012, I actually got chronic pain. I still have that chronic pain. And I went to a doctor, and they prescribed me Percocet, and I was on those for a year from the doctor, prescribed, until he decided to up and retire. And that was when I realized that I was addicted to opiates. And it was so hard. Like, the thing about being addicted to opiates is it's not just a mental thing. Like, it is a physical thing. It gets to the point that you honestly can't even function unless you have them. And it's really, really sad. If you ask me, I don't even think that type of medication should be used. I mean, there has to be another way to treat pain without giving out these addictive medications, because between the opiate addiction and the toxic relationship, it just nearly destroyed my life. I got to a point where I couldn't take it anymore. I didn't like who I was. I have a saying in life that goes like this: if you cannot idolize yourself, then it is time to make changes. So I was obviously at a place where I could not idolize myself. I definitely wasn't happy with who I was and who I'd become, because I ended up even doing harder drugs. Honestly, got to the point that my boys were staying with my aunt because I didn't want them around that. And that's not what I wanted for my life. So I did choose to go to an inpatient, but it was a short-term treatment center. And then after I got out, I've done outpatient treatment from that time. And that's been like the last 3.5 years. And the thing about outpatient treatment, you do meetings, we have groups through the treatment center, therapy, and then, the medication treatment. Now, realizing that the medication treatment actually it made me worse. It did, because those medications are addictive too. Like, they cause withdrawals, which I didn't even know. I did not, to me, I knew, what the withdrawals that I went through when I got off opiates and alcohol and things like that, but, I did not know that just a medication that's supposed to help you could, I guess all of these medications that are supposed to help you, and they become addicting, and it's, Yeah, and I don't know, but I feel so much better now that I've gotten off of my medication. It's been awesome for me, but I don't recommend anybody do that unless they do their research and talk to their doctor about it. I've talked to my doctor and he's approved that for me. Um, I just feel that as far as treatment goes, though, to me, I think that the the long-term inpatient treatment is the way to go. Even though for me it was jail, it was still I did awesome for 3 years. I did great, Just unfortunately ran into got prescribed pills from a doctor, so that caused the opiate addiction, and of course the whole issue with the stuff I went through with my last relationship, which was pretty bad. But yeah, it put me in a really bad place, and the therapy I feel is just necessary. It is absolutely necessary if you want to get better. Because you can get treatment for the drug addiction, but you have to really go down to the root of the problem and see what the issue is. I mean, for me, I've had childhood trauma. I've had trauma as an adult. So I've had a lot of trauma in my life, which is why I used predominantly, because I was just self-medicating because I didn't want to feel like that. But after going to therapy for 3.5 years, I actually feel awesome. I feel like a weight has been lifted off of me. And as far as the drug addiction goes, I did relapse 2 different times. I relapsed on opiates, and then I relapsed on a different drug. But I don't know if I can say that on YouTube, so I won't say that. But so that's the thing about outpatient treatment, is that you're still around everything, and the one thing I think the key to actually becoming successful and overcoming an addiction is that you have to get all toxic people, all bad influences out of your life. You may even have, for me, I had to leave my job because people there were offering me things from time to time. And that's how I ended up relapsing those 2 times, was from people coming into my work and offering me things, and my addict brain that day just not allowing me to control myself to say no. And that's what happens when you're an addict sometimes, that people don't quite understand, is that when you're an addict, I feel like the longer that you have, I've even heard of situations of people that have been clean and sober for 12, 13, 14 years, and they get in a situation and they go to a party or something and somebody offers them something and they can't turn it down. So that's the thing about the addict brain, is that you don't always have control. So the best thing to do to really truly recover is to keep yourself out of all situations that will trigger you. I know that can't always be done, but try your best to do that, and just don't lose focus of what you really want in life. I know it's so hard to overcome this, and people don't understand how hard it really is unless they're truly in that situation. It's has been the hardest battle of my life, I think, was obviously all the trauma I went through, but also dealing with drug addiction has been the hardest thing, because so many times, I mean, I did not want to be that way, but I could not get better, and I'm just so happy I finally have. I feel like that, obviously the outpatient treatment, it did work for me because I am feeling better, but it takes longer. And when you do it outpatient, I think it takes longer. I don't know. But the main thing is definitely go to therapy. Do that. I like to try to, I'm trying to research some more holistic ways of healing. Using CBD and Delta-8 products have been really helpful for me, for my anxiety, and they're not addicting. I don't have to use them if I don't need them or if I don't want to. I never have to worry about becoming addicted to them, like the pills that doctors want to shove down people's throats all the time. It's a sad situation. This is an epidemic we have in our country, and if you see somebody struggling, reach out a helping hand. I feel like that in this life, we all have gifts. We all have things we're good at. And I think we should all use those gifts to help others. We should all, I always say on on my TikTok, you know, hashtag let's heal each other. And I think we should all definitely do that. And so if you guys need help and you feel like you need to go to treatment, definitely reach out. I will try to look up some numbers and put them in the description box that you can call for help. Anyways, I'm kind of losing my voice. This is like the second time I had to record this video. I hope you guys liked it. I appreciate you watching. Thank you for clicking on the video. Share if you think it'll help anybody. Like it if you liked it, which I don't know if you probably did, because again, I'm not the best at this. I'm just getting started out. Anyways, I hope you guys have a great day, and thank you so much for watching. I really, really appreciate it. Bye.